Hey everybody, I'm here live with Dr. Sherry McAllister. So excited to catch up with her. When we last chatted, this thing was an idea coming into reality, adjusted reality, that is. And not only has it hit the bookstores and hit the airways, it has hit it and it goes, whoosh, can't keep it on the shelf. So a lot of you have bought this and read it and have given great feedback. Others went to go buy it and couldn't because it was sold out in all these bookstores around the United States, which is amazing. But now we're circling back in. But in that short period of time that it's been out, man, it's been very short. Number one bestseller on Amazon. Number one bestseller on Barnes and Noble in 5 categories. Number 2 in medicine and nursing, which is amazing because there's not much health information in medicine and nursing, just disease care, and it's already up to number 2. So hopefully number 1 there too eventually. So Dr. Sherry, so many great things, so many great travels and places you've been, people you've talked to, doors that have opened in health and wellness. Forbes has been amazing. The book launch was great. Talk to us. What's happening? Where's it going? What lies ahead?
This is actually the most incredible time for chiropractic. Is I try to make this less about me, the author, but us as collective wisdom and where we can share this book. I literally almost had tears in my eyes about 5 minutes before you and I went live. Is at Thanksgiving, I actually gave this to one of my nephews. And he said, "Is it an audiobook?" And I said, "It sure is." He goes, "Because Aunt Sherry, honestly, I'm much more likely to," he works at a golf course. He said, "I'm much more likely to listen to you than to read." And I said, "Totally good." Gave him the book plus the audio book. And I saw his post on Instagram that it was an exciting journey. So from a young 20-year-old to where I am right now, my heart could not be more full. It's really about reaching that generation that does not have the stigma of knowing what we do and why we do it. And, from the generation Alpha to the Gen Z to the millennials, they've never heard some of the unfortunate nonsense that has gone on before those in the baby boomers and Gen X. So I am so excited to say that we're trying to hit everywhere all the time. And you said sold out. And yes, we were for a short period of time, but we're back online. You can get it in audiobook, you can get it in Kindle, you can get it hard copy. But I will tell you something. This Christmas, the greatest gift you can give anyone at any time for any reason is to ensure that they optimize their health and take them on an adjusted reality journey where they can see for themselves why chiropractic is such an important piece and where we're going. I'll get into that in a minute. So I'm just excited to say thank you to everybody that has supported, and thank you, Dr. Howie, because you've been such an immense support system to get the message of true health into the homes of millions.
Well, it's been exciting and it's made it an easy way because a lot of times, there's a saying called people are down on what they're not up on. And a lot of times that has been pervasive throughout chiropractic. And in spite of all that, still the largest drugless healing art in the world. So because it works so well, people continue to use it, but they don't know why it works or they don't know how it works. And they don't know that, like we talked about in biostacking, that it's not just that's your foundation, but we add with movement and we add the air that we breathe and how we breathe, and we add good clean water and food and why it's so important. And people talk about it, but this book really puts it together in a way where it's also expertly written. So great job, and great guidance from Forbes, who kind of knows what they're doing on their end too to get it out there for us. So what kind of stories have you heard in the short period of time that it's been out, from feedback from people that have read it or listened to it?
Well, one of them that deeply touched my heart, and I'm actually looking at an Instagram post from Woodland Christian School, and it's about one of our colleagues, and it's absolutely fantastic. It's Dr. Christian Sherrill, and he said he's grateful for encouraging students to read and learn more about chiropractic care and the benefits this can bring. He had an ample amount of copies. He started with 20 copies, and I cannot even thank him enough. He's such a rock star. But then he just bought 36 more. And why? Because one of the principals at the college or at the university and high school that he works at actually said, why don't we make this part of the curriculum on the healthcare course that we already teach so they can take chapters and start talking about it? I mean, like that's our whoa moment, that to be in a curriculum, to be able to talk about everything we've been talking about for 130 years, yet they didn't quite hear what we had to say. And now we're going to be in the movie theaters. I don't know if you've
Ooh.
been there, but we have an opening on December, I believe it's the 14th, where Avatar takes stage, and they think this is going to be one of the highest grossing movies ever. But can you imagine seeing a trailer instead of a pharmaceutical ad, which I have seen numerous times while I'm sitting in a movie theater? And it just makes me so angry to see that they're advertising to our young people a pharmaceutical product when an option for holistic care is still not widely understood or used. I think we should be a first choice in the movie theaters. When you get your popcorn and you're sitting, you should see us. It's a journey, and the trailer is amazing. Our pre-trailer. We're also going to be in the airport bookstores during the holiday season, so anyone can pick it up. But thanks to Dr. Cheryl and so many more, they're getting it into the high schools, the colleges, public bookstore. We took it to Bozeman, and the only barrier we have is what goes on in our head, that we don't want to share this, because I think that chiropractic has such an incredible place to be in health care, and that we can bridge that beautiful gap to disease care as well, to help our brethren, our medical doctors, our nurses. The nurses are picking it up. So if the nurses are picking up, they see the value add that can happen when we try preventative first, optimization, and then, should it need be, alleviation, and work with our other healthcare providers.
Well, the message is great. It's inclusive, and it really clears a lot of the cloud cover and the fog that's been allowed to stay longer than it should in and around the messaging of what it is that we're doing. And for me, also, it's helped the doctors, have a better way to even communicate what they've been doing all this time, where they may wonder why not everybody gets it, even though they might get how they feel, they may not get really the depth of what's going on. And this has helped ground that. And also, a lot of people want to share their experience with their chiropractor and their experience that they love, but don't know how to articulate it. But this book so expertly does that. And super cool. I'll be looking in the movie theaters when I attend with my kids. I look forward to eventually probably the adjusted reality movie. Maybe we should talk about that.
There we go.
I think that's a thing that needs to happen. And so what lies ahead? 2026 is coming up. I know this is the year that this message goes global. What do you see coming up? Where you're going to be? Where can people come and see in person? All that kind of stuff.
Well, it's definitely on the road. We're trying to get to as many places as possible. So we just did a meeting at Therma. It's a Silicon Valley company where they value health and true prevention. And they wanted me to come in, and there's a small group of people, yet everybody bought 3 books each. I mean, that's a moment of, is it good for you? Then it should be good for your friends. It should be good for your family. And I want this to be a discussion around the holiday season on how are we really looking at our health, and what are we doing to try to balance our life with the journey of really committing to care under a doctor who really is trying to prevent and optimize your health, than trying to say, mitigate the symptoms or the unfortunate disease process that's going on. So this is a journey to supercharge. And that's why the book frames it as a continuous journey of growth. So when you ask where next, it's all about growth and intentionality, where we want to go and what the destinations are. And I would like to see this book go around the world, and it can do that instantaneously. If anybody would pick the book up and say, I'm adjusted, and post it on Instagram, Facebook, or X, that starts the question of, what does that mean, I'm adjusted? Because I'm adjusted means many things to many people. And for those that are chiropractically adjusted, we know what that means. We just change the balance of our life. But those that are not adjusted, they need to start focusing on what their vitality looks like. How can they get their healthcare taken care of? And who's going to go on that inspiring journey with them? And that's a healthcare provider who truly understands, not treating a symptom, although we are good at treating symptoms and can alleviate pain, but we're really here for whole being care so that you have a person who can walk the journey with you.
So good. Yeah, they say that you don't know what you don't know until you find out you didn't know it. I mean, I don't know how old you were when you first got adjusted, but the first time I did, it was way older than it should have been. But when I did, once your nervous system has an awareness, you never want to go back. And I remember recently having a conversation with somebody who was about to get their first adjustment, and they had asked me about what a big deal it was, and we were talking about what a big deal it was, and I told them that if somebody offered me $10 million right now never to get adjusted again, I would say keep your money. And for someone who's never been adjusted, they don't really know what that means, because there's this feeling and function that you have that is at the height of your being when you're properly adjusted, and people don't always know that. And again, if they've never experienced it, it's like a dog whistle. It's making a sound, but they're not hearing it. And once they hear it, experience it, and again, when it's properly done, it is a euphoric event that you don't ever want to come down from. So this book is having more and more people find their way to that experience, and happy to do our little part in making that happen, and always looking to do more, and appreciate everything that you're doing. What do you want to leave them with? Where else? What else would you want to? I love the idea about posting that they've been adjusted or that they're adjusted. I mean, I think that's really good. It really creates curiosity, creates that conversation, and has people want to know where they can have it done too.
Yeah, I'm adjusted. And that really says everything. And, I was standing in the grocery store and there was an elderly lady behind me. She just picked up her prescription, and she just started chatting about that her prescription was for pain, and it was pain in her neck. And then she goes, "You know what, dear, I really am questioning." She goes, "If this prescription worked, why do I keep getting a refill?" And I stood there and I thought, I really wish I had an adjusted reality book right now, because that's the moment where you capture people's hearts and minds, is that if it's working, should you be continuing to do the same thing and asking for a different outcome? Because really what she wants to be repaired. She doesn't want just the pain to go away. She really wants her life to come back. And so as we move across the world and we start building the understanding and the awareness that we're in a place, that metaphorical mountain, but it's not about the peak. It's about sustaining the progress after you hit that summit. And some of us have hit several summits. So come along on the journey, because it's a wild ride. But I will tell you, you said something beautiful. You said, if someone gave me $10 million, I would refuse it. And I had also a question asked to me in a different podcast, and it was, Sherry, what would it take to take you away from chiropractic? And I had to sit there because it was more than $10 million. I think the price is my life, that there is no way to step away from something that is true and that is functional and that has people performing at their peak in their lives when they understand what it really means to be adjusted. And that reality is where we want to bring you in, have you understand the value system that we have. And that's where we depart from the disease care. We are focused on health care. So you can come on this journey. I would recommend, if you're sitting there right now, if you're a chiropractor, you should be getting your 10-book bundle. You can do that at f4cp.org/adjusted reality. Get a 50% off coupon. You can get that to 10 people. Maybe it's a principal. Maybe it's the mayor of your city. It doesn't matter, because everybody needs an adjustment. But if you're sitting there as a consumer and you're thinking about what is the best gift I can give someone, I guarantee you they will not be disappointed if they pick up adjusted reality, because it makes them think about the greatest gift they have, and that is their body. This is not a app that you go to and you just level up. This is not a video game that you can shoot your way out of it. This is the only operating system you will ever get. It's your choice if you're going to Decide that you're going to take care of this operating system because it's working for you and it adapts every single day. It's up to you to adapt. The second part is once it's not growing, it's dying. That's a choice. We get choices. Let's make good ones.
Absolutely love it. As they say, health is not an event. There's only one way to coast in life, and that's down. So we're either building our health or it's going away. This path is definitely that path. And thank you for answering the calling, Dr. Sherry McAllister. And really, it is only the beginning because every day people take a knee in prayer, hoping someone somewhere is going to help them with something they're suffering with. For so many people, this message has been that. And we thank everybody who's helping us get that message out. And we will continue to keep up with you along the way. Hopefully, you're moving pretty quick, but we'll do our best. And into 2026. And there's no better gift under the tree for somebody who really needs a break in their health than this book and this message. So thanks, Doc.
Thank you for having me.